So my background is Italian. So my father came from Italy, like many Italians after World War II. And on my mother's side, Torres Straits Islander. So I'm a Saibai Koedal clansman. So that's Saibai Island is in the top Western Island cluster of the Torres Straits. I grew up in a urban setting, southeast Queensland, but yet I didn't know there was such thing as a physiotherapist until I was in my mid-20s needing knee surgery. At that stage, I didn't know much about the body, much about the injury. Part of my connection to culture is through movement and dance, and that was a real motivation for me in getting my knee better. As a lecturer now in a physio program, I really enjoy the teaching side, working as a teacher for the next generation of physios, really trying to encourage young Aboriginal and Torres Strait Islander people to pursue a physio career through our program. That's something which I hold and something which I pass on. Part of that role also enables me to do research as well. That research journey started off as a clinician. So working in a specialist centre for heart and lung, I encountered a very rare and special cohort of people who were affected by rheumatic heart disease. They were primarily Aboriginal and Torres Strait Islander people. Very different from our other heart surgery patients who were a bit older and non-Indigenous. The rheumatic heart disease patients were almost entirely Aboriginal and Torres Strait Islander people, and they were young people at 18 years old or in their 30s. And they were presenting in a critical condition requiring stabilisation in our ICU. So having seen a series of these patients coming through our ICU, I looked into the condition and I was appalled to find out that this condition was caused by a preventable infectious disease called Streptococcus. And it's a condition which was common back in the 50s in Australia amongst all people, but now is almost entirely a condition of Aboriginal and Torres Strait Islander people, but also people who have immigrated from low to middle income countries, or Maori or Pacific Islander people as well. So it's just one of those preventable conditions which affect young people related to social disadvantage, and it shouldn't exist in Australia. So knowing that, as a clinician, I decided to do some work within my hospital setting. I realised that not only the patients didn't know much about their condition, but the people who were responsible for their care didn't know much about their condition. My research will hopefully help inform service delivery and resource allocation across the state and really raise awareness for this condition. Hopefully, my research will help impact the biggest cause of inequity, certainly cardiovascular inequity in Australia. My interest and passion really is that intervention-based research using that community action participatory style where you're working directly with community-led research with place-based solutions. The big work needs to be done with working directly with communities to co-design, co-develop local strategies. You can't just take solutions from one area. It's very place-specific. The advice I'd give to a non-Indigenous ally of Aboriginal and Torres Strait Islander people, particularly someone who's in a position to impact health service access or provide health service, first and foremost, embrace that journey of critical reflection, improving your own cultural safety for all your patients, First Nations people, but anyone whom does not share your cultural background. Secondly, just recognising that health outcomes go beyond clinician to patient interaction, and you can impact other factors, other systemic factors, other structural factors within your service, and that can be really empowering.